Hi, it's Matthew Long here again. I hope you're doing well. You're really getting into the course now, so you should be really kicking ass on all this anxiety and stress. But if you are having any difficulties with anything, then please don't hesitate to get in touch. You've got the email address, you know how to get hold of me, so please do. That's what I'm here for. Now, we're going to be covering something today that's going to be completely different. So if you are struggling, then give this as a go. This is a really good tried and tested method, but it might be something you're not familiar with, which is why we're going to introduce it today. So please bear with me on this one. A little bit long-winded to start off with, but we've got a nice practical bit at the end, which we can get involved with together. Okay. So we're going to be covering something called EFT, Emotional Freedom Technique. And we're also going to be covering EMDR, eye movement, desensitization, and reprocessing. You can see why they shortened it to EMDR. So first of all, EFT. So what is EFT? Okay, it was originally founded and created by a guy called Gary Craig out of another technique called thought field therapy. Difficult words to say fast. All right. Okay. But it involves tapping on certain parts of the body. Now, EFT works on the premise that when you have a negative emotion, it causes a disturbance in the energy system within your body. Okay. Now, if you tackle these disturbances while you're focusing on the problem, or the issue or the negative emotion, then what you'll notice that will dissipate and it will start to disappear. And the more you do it, the more it dissipates. So how does EFT work then? Well, it works by gently tapping specific points on the body, which are all mirrored around the meridian system, the energy pathways in the body. Okay. Now this has been used for thousands of years by traditional Chinese medicine. So it's nothing new. And it's certainly, you've heard about acupuncture and how that helps people. And we're basically be tapping on similar points that might be used in acupuncture or acupressure. Okay. So some people have referred EFT as acupuncture without needles, which is a great way of looking at it. And if you've got a needle phobia, you can use EFT to get rid of your needle phobia before you have acupuncture, which is a great way of doing it. So what we're looking at doing when we're tapping different parts of the body, and it might be the collarbone, it might be the back of the hand, and we're going to take you through these at the end, the practical part, but we're trying to unblock the area that's been blocked up where the energy is being hard to explain that one. We're trying to release the blocked energy in various points in the body. Okay. Got my tongue tied there. Hope you don't mind. Okay. So while we're doing this tapping or wherever it is on the body, we're going to be focusing on the problem, the issue, the negative emotion, and using a combination of body movements towards balancing the energy system and negative emotions. And hopefully that will then be released. Okay. And once it's dissipated, you'll feel a lot better. So what can EFT be used for? The list is almost endless. Okay, it's been used for both physiological and psychological issues. I was using it the other day when my shoulder was playing up, and by the time I'd done a couple of sequences of EFT, my shoulder pain had almost completely gone. So it was a great technique to be using at that time. So tapping can be used for many different things, including weight loss, eating problems, pain relief, PTSD, anxiety, depression, all sorts of different addictions, phobias, self-esteem, self-confidence, autoimmune diseases, grief, relationships, insomnia, exam worries, general stress and anxiety. Well, we can keep going, and I'm not going to, because otherwise I'll bore you to death. So what the founder said, Gary Craig, is, well, if you're not sure, try it on everything, because you just never know if it's going to work or not. And if it works, brilliant. If it doesn't, you've lost a few minutes of your life, but it's nothing serious. Okay. So the great thing about EFT and the sequence I'm going to take you through today is that it can be done seated. Okay. However, if you do decide to go and meet with an EFT practitioner to help you through maybe more complicated issues, then it's worth knowing that you don't need to talk about it. You can work completely content free. Okay, which is a great thing to do. So if you've had past trauma and you don't really want to talk about it, because no one really likes talking about their past traumas, you can still just focus on it in your mind, think about it in your mind, go through an EFT tapping sequence, and then the negative emotion will be released and you'll feel a lot better for it. Okay, so we're going to go through a tapping sequence shortly, but first of all, we need to discuss EMDR, eye movement, desensitization, reprocessing. Okay. Woo. big long words. EMDR for short. Okay. Now, originally MDR was developed by a lady called Frances Shapiro. That's Shapiro, pronounce it properly. And what she noticed is that when she was having negative thoughts and that, she noticed her eyes were moving side to side. Okay, so what she noticed then is she forced the movements from side to side, that she could almost control the emotion. Okay, and her anxiety and stress was reduced. So she brought this technique in through a bit of trial and error while thinking about traumatic thoughts, and noticed that the negative emotions with it were reduced. So EMDR is a well-practiced technique in combat PTSD. A few of my friends have had EMDR when they've been struggling, when they've come back from Afghanistan, etc. And it's really helped them, and they tell me about it and how much it's helped them, which is great because I can have a conversation with them, which is nice. Okay, so it's very much specialized for PTSD, but it can be absolutely used for anything, any negative emotion that you're feeling. And when you look at PTSD, well, a couple of the first things you look for in PTSD is anxiety, stress, hypervigilance. And so when you've got anxiety and stress, quite often you have hypervigilance anyway, because you're always thinking about what's going to happen next. All right, so there's a lot of crossover with the different types of feelings, symptoms and everything with PTSD and anxiety and stress. So you don't have to have one or the other. You can have any combination of these symptoms, and you can use EFT and EMDR to help you. Okay, so with EMDR, we're going to be looking at moving our eyes from side to side, and I'll take you through that in more detail. All right. Okay, what we're going to do now is we're going to go through a complete sequence of EFT with EMDR, and we're going to do it slow time, just so you can understand it. And then we're going to go through a full one in real time, so that you can use that one to just follow whenever you want to do it until you've memorized it, which doesn't take much. And then you can use that one in the future. Okay, so the first thing we're going to do is we're going to start tapping just above the right eyebrow. Now we're looking for not on the bone, but just above it, where there's a little bit of flesh, a little bit of soft tissue, and it's nice and comfortable. We don't want to tap too hard, don't want to give yourself a headache. Just a nice gentle tap. 1 finger, 2 fingers, 3 fingers, doesn't really matter. You're going to hit the right area. And you're going to do that for about 10 seconds. And all the time you're doing that tapping, you want to be focusing on your negative thought, feeling or emotion or pain or a situation you want help with. And that's going to allow the body to use that energy to help you. Once you've done 10 seconds on the right eyebrow, you're going to do 10 seconds, approximately 10 seconds underneath the right eye. From there, we're going to go to the collarbone. Again, we've got that nice bony bit in the middle here, and that's coming into the sternum, but we want that little bit of flesh just underneath it. We've got a nice little, again, a nice little bit of soft tissue. And again, we're going to be doing that for about 10 seconds. From there, we're going to go to, keeping on the right hand side, we're going to go to underneath the arm, and we're going to use that latimus dorsi muscle. And again, we're going to do that for 10 seconds while focusing on our negative thought, feeling, emotion, or pain or situation, whatever it is. From there, we're going to go to the right hand side of the outside of the right hand. Okay, so between the knuckle of the little finger as it joins the hand and the knuckle of the wrist, that nice fleshy bit, like you're doing a karate chop. And again, we're going to do that for about 10 seconds. From the right hand, then we're going to move over to the left, and we're going to work our way back up. So from the right hand, we go to underneath the right arm, left arm, left hand to left arm. This is going to be mirrored, so I hope it doesn't get too confusing for you. From there, we're going to go to the collarbone. Now, it doesn't matter which hand you use. You might find one arm gets tired after a while. So from the collarbone, underneath the left eye, from underneath the left eye, back up to the left eyebrow. And that's basically the sequence we're going to follow each time. For the tapping part, what we do after we've done the tapping bit, so right hand side down, left hand side back up again, we're now going to do the EMDR. Now the EMDR, we're going to start with the eye movement. We're going to be looking left, we're going to be coming up in an arch to the middle, and then down to the right. Then we're going to swing around to the start, and we're just going to repeat that 5 times. So we look left, up to the middle, down to the right, and then swing round. And what we've got to remember is to try and keep your head still and only move your eyes. So look left, up to the middle, down to the right, and then swing round back to the left. up to the middle, down to the right, swing round. And we're going to repeat that 5 times. Okay, and we'll do this in the full version. After we've done the EMDR sequence, we're then going to sing happy birthday to ourselves. And you can sing if you want to, but I'm going to hum. Okay, but when you play it in your head and you've got the words in your head, when you get to the name part, just put your own name in. And the great thing about happy birthday is you can't help but smile. So we're reinforcing some good, positive, nice feelings. Okay, so we're going to do this. We just do it once. Okay, and I'm just going to hum it for you now. Okay, don't forget to put your own name in it, and it's happy birthday to me. Okay, so once we've done that, we're now going to do 5 slow breaths. We're going to 5 seconds in, 5 seconds out. Okay, and we do that 5 times. Now, don't worry if you can't control it for 5 seconds at first. As your breath starts to calm down, you'll be more manageable. Like I said, we're going to do 5 slow breaths in and out, 5 seconds in, 5 seconds out. Once we've done that, then we're going to basically just repeat everything we've just done. So what I'm going to do now is I'm going to go through a complete run through, doing the whole sequence. So we start off with tapping the right eye, just above the eyebrow. 10 seconds while focusing on all your negative thoughts, feelings and emotions, pain or situation you need help with, underneath the right eye. Underneath the right collarbone. Underneath the right arm. Outside of the right hand. Cross to the outside of the left hand. Underneath the left arm. Left collarbone. Underneath the left eye. Above the left eye. And now into EMDR. Look left, look up, look right. Swing round to the start, look left, look up, look right. Swing round to the start, look left, look up, look right. Look left, look up, look right. Look left, look up, look right. And now we're going to do humming happy birthday to me. 5 slow breaths, 5 seconds in, 5 seconds out. Now we're going to take note of our level of anxiety, stress, whatever it is we were trying to have help with. And to be quite honest, my anxiety right now is nearly 0. Nice and chilled. And you can repeat this sequence as many times as you need to make sure that you feel better, to help with pain, help with panic attacks, anything that you need. It's a great way of just realigning all that energy and meridians in your body. Now, whether you believe in energy or meridians, or whether this is a viable scientific thing to do, the proof is actually in the results. And that's all we need. Even if we don't fully understand why it works, if we go through this sequence, you pretty much guarantee that you will feel different afterwards. So if you've got a level of anxiety that's an 8 out of 10, go through once, you'll probably find it's gone down a couple. By the time you've done it 3 or 4 times, you've probably gone right down to 1 or 2 on your anxiety, if not down to 0. So do give it a go. See how you get on. By all means, give me feedback. Let me know how you find it. And I look forward to seeing you in the next video. Take care.